Hello everyone, welcome to this video. So in the last video we discussed about the role plays, the introduction, how to start the role play in OET. So as I mentioned in the last video, that in the next video I'll be discussing about how to conduct the OET role play when you are talking to a carer or the parent of the patient. In other words, when you're not talking directly to the patient. Okay, let's start now. So let's take a look on the role play with similar scenario for nursing. We are looking at a nursing role play card, and here you can see from the setting that you are at suburban health clinic. You have a patient who is 1-year-old baby and having small papules and vesicles all over the body. Here you are not talking to the patient herself. You are speaking to the mother of the patient. This time you don't need to elaborate the introduction. What I mean to say is, you don't have to exchange pleasant reasons talking about, hi Mrs. Maria, how are you? These things. So because this parent is very worried about her daughter. So let's have a look at a good introduction. So here, the setting is suburban health clinic and the patient is a parent of a baby of 1-year-old. So, a parent with a child of 1-year-old has visited your clinic with the complaints of itching, redness and papules, which seems to be eczema. So this is a scenario. You are having a patient who is a 1-year-old baby and you are talking to the mother of the baby. Here the mother is worried because of her baby's condition. He is having the papules and vesicles all over the body, and we'll be starting like this, that hi, good morning, my name is Anna, I'm one of the nurses here in this clinic, so how may I help you? So this is a good introduction, very brief. Like you can't say hi, how are you doing, okay, all right. So this is not the way. She's worried, so we'll just straight away ask, how may I help you? She'll say that she has brought her baby and her baby has developed some small papules and vesicles all over the body. So you will not waste any time. You will just ask her a few questions like about her condition, or first of all you can ask about, can I examine the baby and for how long a baby is suffering from this problem, and is it for the first time or not, and have you given any kind of medication to your child, did you consult the doctor or not. You'll take information from the parent. Then afterward you have to explain the causes. You just have to say like, okay, I understand, but do not worry, it's not a permanent condition, it's a temporary one and it's curable, so don't worry, it's very common in small babies. You can say there can be many causes of eczema and among infants, and such as it can be due to breast milk or cow's milk, which is the most common reason. As well as you can also say that it may be sometime the babies, they inherit this thing from the parent or one of the parent. Or there are many other things also from which baby can have rashes or we can have papules. Like it can be from the fabric of clothing he or she wears, or it can be due to the cosmetic product. There may be many reasons. You can just tell your client, you can tell the mother like this. Then also you need to discuss the interventions with the mother. Like there are many ways to cure this. Like in case of babies, she can apply the coconut oil, which is the most safest thing. And also you can ask her to provide your baby with the warm water bath and keep the skin moisturized, because this can be also the reason, like if the skin is dry, then also baby can have that papules and vesicles. So she need to keep the skin of the baby moisturized with the help of the moisturizer. And also in the end you need to again reassure her that everything will be all right and it's a curable condition, so don't worry about it, your child will be all right. So this is how you need to complete the role play. You need to take care of your task very carefully. The introduction should not be very long, it should be very brief and short. So I again repeat it, like you have to greet the patient, take the information, examine the patient, and you need to provide the solution or provide the treatment methods according to the task given in the role play. And then in the end you need to reassure her, and you can also say that this is my phone number and your child will be all right within 2 to 3 days, or if nothing goes better, just update me or call me regarding your child's condition, and if you need any help you can anytime call on this number. So this is how you can just tackle the mother and you can deal with this kind of patient. So I hope you understood well with both types of role plays in which you are talking directly to the patient, and in which you are talking indirectly to the patient, like you are talking to a parent or the carer of the patient. If you want online or offline classes, just call on this given number and enroll today, and you just start your preparation with us and you'll be getting your desired scores. Don't worry, keep on practicing, keep on taking guidance from us. You'll definitely succeed in OET. Thank you for watching. Bye bye. Take care.